I'm Dr. Katie, the Senior-Centered Physical Therapist, and welcome back to my channel. In this exercise video, I'll be showing you exercises to help maintain and improve the strength and range of motion in your shoulder and rotator cuff. In order to do that, you'll need just a few things: a resistance band, a couple towels. They can be small, like kitchen towels, as well as a wall to press against, so a stable surface that you can put some weight on, and then something to lay down on as well. Before we go any further, if you could click the thumbs up button as well as the bell to subscribe to my channel, I would really appreciate it. And if you want more information on the rotator cuff and how to improve its overall health, check out my blog, theseniorcenteredpt.com. What I'm going to show you is just a snippet of each exercise, but I highly recommend that you do 3 sets of each exercise. When it comes to how many, I would recommend 8 to 10, but that's totally dependent on you. If you get to 8 and you're so tired that you have to take a break, go ahead and take that break. That's no problem at all. If you're able to get to 12 or 15, maybe think about increasing your resistance on your band or adding some weight. So 8 to 10 for 3 sets is the goal, and start wherever you need to. We're gonna do some scapular retractions, which are also sometimes called shoulder blade pinches. That's kind of a misnomer because I want you to think about bringing the shoulder blades together in the back rather than pinching them really hard. So it's just a nice smooth movement bringing those shoulder blades together. I'm gonna turn to the side so you can see me a little bit better. You can do this either standing or sitting. If you're standing, I'd actually recommend you going up against the corner of a wall, and you'll put your scapula on each side of the corner, and then you're just gonna bring the scapula together, hold, and then relax. So the wall gives really good feedback. You can feel those shoulder blades kind of hugging around the corner of that wall. So we hold for 3 seconds and then relax. Notice there's not a lot of movement in my shoulders. I'm not flinging my arms back and forth. I'm just moving at the shoulder blades. Sometimes we can think too of opening the chest in the front. So open that chest, make it really wide in the front collarbone area, and then relax. Now I'm gonna show you what this looks like with a close-up view of my back so you can really get an idea of the muscles moving in the back body. Next, we're gonna do some wall washes. So this is where we're gonna grab our towels, put them underneath our wrists so that we can slide up the wall easily. I'll show us the form first, and then I'll turn around and show you how to do the exercise, and you can get a closer look of the back and how the scapula are moving. So what you'll do, you'll have that towel underneath each wrist, and then you're gonna place your wrists, so pinky side, against the wall, about shoulder distance apart, about shoulder height, and we're just gonna move up the wall and back down, and then up the wall and back down. And it's kind of wherever your shoulder range is at the moment. So it doesn't need to be painful. We actually don't want it to be painful. We just want you to move through that motion, up and down. And then what we'll do is we'll come out a little bit at an angle. So we call this scaption. And if you think about those 2 words, scapula and scaption, so it's how the scapula is moving. So we're gonna be kind of at a V, up and down. What's really important is that we have a tall posture. So if I'm slumped over and I'm trying to lift my arms, it's really hard to lift those arms up there. So I wanna be in a tall posture. Those shoulder blades are a little bit towards the center of my back. That way my shoulders aren't rising up to my ears. And we're holding this nice position as we move up and down, which gives the shoulders a little bit more room to move. So now I'm gonna turn around and demonstrate that motion using the towels and the wall behind me so that you can get an idea of what that motion really looks like. Tall posture, my wrists are up against the wall, and then I'm just gonna inhale, bring those arms up, exhale, bring them down. Inhale, bring it up. Exhale, bring it down. Nice and slow, so we want to focus on that motion in the arms. So once we've done about 5 to 10 there, we're going to move the elbows out to that V, up and down, up and down. Now we're gonna do some rowing. So this is where you wanna grab your resistance band. You can either fold the band in half, tie a knot in the top, and then stick it in a doorway, close the door so you have something to pull against, or you can just put it right underneath your shoes. So I'm gonna step on the center of this TheraBand. You can also do this sitting if you would like. I prefer to do it standing. So grab the TheraBand. You can either wrap your hands around the band or just hold on. And then we're gonna hinge at the hip. Notice I'm not rounding in my back. I'm just tipping forward at the hip. And then I'm gonna have to choke up a little bit on my band here. And once again, I'm moving from the scapula. So shoulders are down away from the ears. My scapula move, and then my elbows follow. So my scapula move, my elbows bend, finishing that movement. Notice the posture, flat back, making sure we're not rounding in that back. Slight bend in those knees. And once again, nice and slow, smooth movement. And making sure we're not clenching, we're just sliding those shoulder blades back, bringing the elbows along for the ride. And then we're gonna stand up. Next, we're gonna do what are called flashers. So as the name kind of implies, we're gonna pretend like we're flashing someone. We're gonna pretend like we're opening that jacket, right? So grabbing that resistance band, you're gonna place your hands, palm face the ceiling, and then grip that band. And then the closer you are, the more resistance it is. So you can give yourself a good bit of slack. My arms are down by my side, so my upper arm's kind of hugging into my rib cage just a little bit. And there's a little bit of space between my elbows and my rib cage. So I'm not crammed down here. It's just that kind of armpit is setting my shoulders. And then all I'm gonna do is pull the band apart, bring it back in. So think about the pinkies moving away from each other, pinkies moving away from each other, and back in. Once again, this is a back body exercise. You're using those shoulder blades to move the band apart. The hands go along for the ride. My shoulders are away from my ears. We're opening that chest nice and wide. Whew. And you only have to do a few of these before you really start to feel them. Let's get one more in here. And then bring that band down. Now we're gonna move into our side lying external rotation. You wanna grab a towel, and then you're gonna lay on your side. If your shoulder is bothering you, you're gonna lay on the shoulder that's not bothering you, so we can work the shoulder that needs to get some strength. If you've got healthy shoulders, you're just doing this to increase your strength. Congratulations, well done. You'll do it on both shoulders. And if it's too easy, you can add a weight as well. So add small increments at a time, build up. Just know where you feel a challenge, but not pain in this movement. You're gonna take your towel and you're gonna roll it. So my towel's already folded in half, and then I'm just rolling it like a little burrito. Now I'm gonna lay down to my side. And I'm just gonna put that little burrito roll just above my elbow there. So you can kind of be a little bit more on the armpit, kind of wherever feels natural to you, to give you some space though between the armpit and the rib cage. So the idea here is if we're doing this motion and there's no towel there, we're kind of clamped down on the rib cage, and it can impact our blood flow actually. So we want to bend at the elbow and then rest our head down on our other arm so we're nice and comfortable. And then I'm just gonna bring this top hand down to my belly and then lift it up. Inhale, bring it down. Exhale, lift it up. So I think about that humerus, that arm bone, rotating in the socket. So think about the arm bone is forward right now. We want to rotate it back. It's really not a big movement, right? But we're just working on this external rotation, which is what most of the muscles in our rotator cuff do. And doing it in this way takes gravity a little bit out of the equation, so it's not as difficult if we are having some shoulder pain. Once again, if you are feeling really good and this is too easy, add some weight. We'll just do a couple more here. And then let it rest. From here, we're going to roll onto our back to do our serratus punches. So we're gonna roll here. And then I like to keep my knees bent to help with not putting too much pressure on my low back. And then I'm just gonna bring my hands up towards the ceiling in front of me. You can make fists or you can point your fingers, whatever works best for you. So what we're gonna do is we're gonna imagine reaching towards the ceiling and then coming back down. So my back is not lifting, I'm just reaching towards the ceiling, bringing the shoulders back down. So this is working a muscle called the serratus anterior. It's our boxer muscle. So that's why if you want to do the punches like this, that's totally fine. But help support that shoulder. Helps in movements that we need for function. And this is a muscle we do not work enough. So we're reaching towards the ceiling, bringing the arms back down. This is also one that can be really challenging for people because, like I said, we don't do this very often. So it's kind of hard to coordinate. So don't get frustrated. Just know it's gonna take a little bit of time. I think about leaving my spine on the table or on the mat and then bringing the shoulders away from the mat. Spine stays, shoulders go. And then you can bring those hands down and take a rest. And we'll move on to our serratus push-ups. So you're gonna roll up to seated position and then get to standing. To do our serratus push-ups, you can either use an elevated surface that's really stable, like I'm going to use, or you can start with the wall. I do highly recommend starting with the wall because once again, not a movement we're used to doing. That wall's a really nice stable surface, of course, that gives you good feedback. If you'd like to move to the table, that's fine. It's gonna be a little bit more pressure on that shoulder. So if you're starting at the wall because your arm's a little bit sore, that's great. I'm gonna demonstrate here by turning around and showing you how to start on the wall, and then I'll move to the table. So you're standing and facing the wall. You're gonna put your hands on the wall at chest height and then walk your feet back so you're in kind of a diagonal plank. You're gonna push away so that your arms are completely straight and you're keeping them straight as you lower the chest towards the wall, then lift the chest off the wall. Lower the chest towards the wall, lift the chest off the wall. Notice my elbows are not bending at all. So very different than our traditional push-up. Now I'm gonna demonstrate that on the table. So you put your hands against the table, walk your feet out. So you're in that plank position. I'm keeping my elbows straight as I lower my chest, lift my chest. Lower my chest, lift my chest. We're gonna do 2 more. And then walk it in. Thank you so much for watching this video. I hope you enjoyed it. Please remember to revisit this video. Continue to do the exercises to help maintain your strength and your range of motion in your shoulders so you can continue to live life to the fullest. As always, please check out my blog, theseniorcenteredpt.com, and remember to give this video a thumbs up as well as hit that bell button to subscribe so you don't miss out on any future content. Until next time, I'm Dr. Katie, the Senior-Centered Physical Therapist. Have the strength to live life to the fullest. Bye-bye.